Lifestyle interventions in prostate cancer surveillance. A man gets diagnosed with prostate cancer, and the doctor tells him something he wasn't expecting. Maybe we just watch this. Don't operate, don't blast it with radiation, just monitor it. For years. And here's the thing. That man suddenly wants to know, can I actually do something about this myself? Can my gym routine matter? Can what I eat change the trajectory of a disease that's literally inside my body right now? Turns out, those questions have been sitting unanswered for a very long time. Until now. But the answer might surprise you more than the question itself. Active surveillance for prostate cancer is actually a pretty recent invention in the grand scheme of medicine. For decades, the standard playbook was simple. You find it, you remove it, or irradiate it. You move on. But in the 1990s, urologists started noticing something awkward. A lot of men were being treated for cancers that would have never actually killed them. Some never would have even grown. So the idea emerged. What if we just watched certain low-risk cases instead? Check it regularly, and only step in if something changes. It sounds radical, but it's actually become standard practice now. The problem is, once you tell someone to wait and watch, they want to know what they can do in the meantime. Can diet help? Does exercise matter? Should I take supplements? Does weight matter? And for years, doctors would basically shrug. The evidence was scattered, contradictory, or non-existent. This review was designed to actually answer that question comprehensively for the first time. This work comes from a team of urologists based in Rome, researchers at the Gemelli Hospital and the Catholic University of the Sacred Heart. The lead authors are Marco Campetella and Francesca Bizzarri, along with colleagues Russo, Biantinesi, and Rocco. These are people who see this exact situation constantly. Patients sitting in their office wanting guidance that doesn't really exist yet. The paper was published in April 2026 in the Journal of Clinical Medicine and went through proper systematic review protocols, registered with Prospero, to prevent cherry-picking data. This wasn't a quick opinion piece. It was comprehensive work designed to pull together everything we actually know. So what did they actually do? The team searched medical databases, PubMed, Cochrane, Scopus, for every study published between 2000 and 2025 that specifically looked at lifestyle interventions for men on active surveillance for prostate cancer. Think of it like they assembled a massive jigsaw puzzle. They found over 30 studies with different methodologies. Some were randomized, controlled trials where half the guys did an intervention and half didn't. Some were observational studies just watching what happened. Some even included interviews asking men how they felt about all this. They were incredibly strict about quality, using something called CASP tools, where 2 independent reviewers would assess each study to make sure it was actually rigorous. It's like having 2 security guards at the door of a nightclub, both checking IDs independently, so you know nobody's getting in who shouldn't be there. The result was a curated collection of evidence about what actually helps men on active surveillance. Here's what emerged. Physical exercise was the star of this show. The data consistently showed that men who exercised regularly, and we're talking structured, intentional physical activity, not just moving around the house, showed improvements in cardiorespiratory fitness and quality of life measures. Now this is important to be precise about. The research didn't show that exercise stopped cancer growth or prevented progression. That would be the dream outcome, right? But it did show that exercise made men feel better, have more energy, and maintain better cardiovascular health, which matters enormously because prostate cancer patients actually die from heart disease more often than from the cancer itself. Dietary changes also showed promise, particularly diet patterns like Mediterranean-style eating with lots of vegetables, fish, and healthy fats. The effect sizes were modest. This isn't magic, but they were consistent across multiple studies. Weight control seemed to matter, though the evidence was less abundant there. And here's the potentially controversial part. Supplement use showed minimal benefit overall. Men were spending money and time on supplements with very little evidence they actually did anything meaningful. Safety-wise, the good news across the board was that these interventions are low risk. You're not going to harm yourself by exercising or eating better while on active surveillance. That might sound obvious, but it's actually worth stating explicitly, because when you're dealing with something as emotionally fraught as a cancer diagnosis, you want to know that the things you're doing to help aren't actually making things worse. The other finding worth highlighting is feasibility. These interventions actually fit into people's lives. They don't require specialized equipment or constant medical supervision. A man can take a walk, join a gym, change his diet, and do all of this without derailing his normal existence. What does this mean for someone actually in this situation? If you or someone you know gets diagnosed with low-risk prostate cancer and your doctor suggests active surveillance, one implication of this research is that you have some agency here. You're not just passively waiting. You can actually structure your lifestyle in ways that, at minimum, will make you feel better and improve your overall health. That exercise routine you've been thinking about? There's legitimate science suggesting that's worth doing. That restaurant you've been avoiding because of cholesterol? Incorporating more of those Mediterranean-style meals seems to track with better outcomes. But here's what this research is not saying. It's not saying lifestyle changes alone are going to cure your cancer or prevent it from progressing. Some men on active surveillance will need treatment eventually. That's just the reality. What this is saying is that lifestyle choices seem to matter for quality of life and overall health during what could be years of monitoring. It's not a magic bullet. It's more like, it's one of the bullets, if that makes sense. The honest limitations here are worth acknowledging too. The studies varied enormously in how they measured things and what populations they looked at. Some studies were small. Some followed men for only a short time. The heterogeneity made it tricky to do meta-analysis. That's the statistical combining of results. So we're pattern matching across different research approaches rather than having one perfect answer. This is where future research needs to get more specific. We need larger randomized trials. We need longer follow-up periods. We need to understand not just whether exercise helps men feel better, but whether it actually influences cancer progression rates. We need to know if certain diets matter more than others, and we need to understand which men benefit most. Is this equally helpful for everyone on active surveillance, or are there patient characteristics that predict who really needs to do this? What this also does is change how we think about active surveillance conceptually. It stops being this purely passive watching and waiting, and it becomes something more like active management through lifestyle. The name itself might need to evolve. You're not just passively observing your cancer, you're actively trying to optimize your health in the meantime. That's psychologically different for patients. It gives them something to do. It gives them some control in a situation where control is usually the one thing that feels missing. It also raises an interesting question for healthcare systems. Should urologists be prescribing exercise programs and dietary counseling as part of active surveillance protocols? Should these conversations be routine, evidence-based parts of the process? Right now, they often aren't. This research suggests they probably should be. Turns out, scientists have been busy pulling together what we know about staying healthy while waiting to see if your cancer needs treatment. And what they found is that the things that make you generally healthier, moving your body, eating well, maintaining a reasonable weight, actually still matter, even in this specific and unusual medical situation. The research is incomplete, and the effect sizes are modest, but the message is consistent and encouraging. It's not magic, but it's something. And for someone sitting in that doctor's office after a cancer diagnosis, something is better than nothing. Turns out scientists have been busy, and they're not done yet.